How's it going, guys? Past level question, thyroid repro, steps 1 and 2. You have a 29-year-old woman, first antenatal screening last menstrual period 8 weeks ago. She's receiving levothyroxine T4 for a 3-year history of Hashimoto. Her TSH free T4 in the normal range. And the question wants to know if her TSH increases during pregnancy, the fetus at greatest risk for which of the following. So before we even hop into the answer choices, I want you to memorize that in pregnancy, in women, 99% of the time, when they're euthyroid asymptomatic, you're going to have no change TSH, no change free T4, up arrow, total T4. And that's because estrogens, not progesterones, are causing the liver to secrete increased thyroid-binding globulin, TBG. If you're confused about all the mechanisms regarding that stuff, go to my high-yield endocrine and ARAS PDFs that I've linked down below, okay? But you need to know that as a step level pass question, okay? So pass level step question there. So let's just hop to the answers. Choice A, abnormal brain development, correct answer. So you need to know that if her TSH is increasing during pregnancy, this reflects hypothyroid state. Okay, so obviously if she's got a history of Hashimoto, so if this were to be exacerbated during pregnancy and her T3 and T4 drop, then her TSH would go up. So the question is just saying if the mom becomes hypothyroid in pregnancy, fetus at greatest risk for which of the following. So cretinism is when you have the syndrome of hypothyroidism in a neonate, which is abnormal brain development, neuronal development, which you need thyroid hormone for, causing mental retardation. You can have enlarged tongue, enlarged fontanelles. You can have a pot belly that looks similar to kwashiorkor, which is protein calorie malnutrition but unrelated. So that presentation you have to know in the neonate cretinism. But in utero, there's going to be abnormal myelin sheath development, abnormal brain development. It's the highest yield answer that they want for this question on the NBME exam. So let's just hop to the others. Congenital deafness, wrong fucking answer. Now this is where some students are going to get emotional and hyper pedantic, because if you were to Google hypothyroidism effects on the fetus and deafness and treating growth restriction, I mean, can those things occur? Absolutely. 100%. Okay. But it's about the best answer on the NBME. And the best answer, what's most likely, what's most dangerous, is the abnormal brain development. This is the high yield answer they want. Okay, so if you disagree with it, take it up with the NBME exam. Congenital deafness, I would say, as per my observation, this relates most to Torch's congenital CMV. Okay, so obviously you get it with congenital syphilis, rubella as well, but congenital CMV, they like deafness for that. Could also be other things like aminoglycoside use by the mom during pregnancy can cause cranial nerve 8 damage in the fetus. Wrong fucking answer. Choice C, IUGR, wrong fucking answer. I just harped on. It's possible, but it's not the answer they want. Things for USMLE you should know: smoking, cocaine use, hypertension can all cause intrauterine growth restriction, and SLE. Okay, so SLE, IUGR, recurrent miscarriages, and for 2CK step 3, and this will sound a little bit weird, the fetal growth parameter on ultrasound that they want most reflective of IUGR is abdominal girth, not biparietal diameter / head circumference. It's wrong, as well as crown rump length, which is the fetal length. Okay, so you say for IUGR, why specifically abdominal circumference over head circumference and crown rump length? It's just what they want. Wrong fucking answer. Choice D, pituitary apoplexy, wrong fucking answer. It means bleeding into the pituitary, obscure condition. I've only seen one question asked on this. It's on a 2CK neuroform, and it doesn't even require that you know what it is to get it right. They give a woman who you can see in hypertension, you can see it in pregnant women. All right, but bleeding into the pituitary, the question on the 2CK form, they just basically give a woman who recently gave birth and they say she has bitemporal hemianopia, and you normally think of pituitary tumors causing that, and it happens to be for that question that pituitary apoplexy is the only answer that relates to the pituitary, period. So you say, well, I guess that's what's causing your bitemporal hemianopia, where the other answers are obviously wrong. Wrong fucking answer. Choice C, thyroid gland enlargement, wrong fucking answer. So I mean, it's a reasonable thought. You say if there's in utero hypothyroidism in the fetus, couldn't that cause a goiter? Or conversely, let's say some of you thought about this the wrong way, where you said if she has increased TSH, couldn't that cross the placenta, bind to the thyrotropin, which is another name for TSH? Couldn't that bind to thyrotropin receptors on the fetal thyroid gland, precipitating even a hyperthyroid state in theory, causing a goiter? I mean, they're thoughts to consider, but as I've already said, what the USMLE wants for hypothyroid state in the mom, in terms of effects on the fetus, is abnormal myelin sheath slash neuronal development. They can also give you impaired bone growth, linear bone growth. Okay, not to be conflated with IUGR, as we already talked about. I said this was abdominal girth, not even crown rump length. Choice E, wrong fucking answer. You know, do you want me to make more content? You like my subscription? Appreciate your time. That's it.